Everyone. We are just going to give Maddie 1 second to join, and there they are. Hi, Maddie.
Hi, can you hear me?
I can. Can you hear me okay?
Yeah, I can hear you. Here, 1 second. I'm gonna turn you up.
Okay, awesome. Well, I'm super glad you're here. Really grateful that you're here. Looking forward to getting to talking to you. Just going to do some introductions quickly. I am Matthew Murray, for anybody that doesn't know me. I use he, him pronouns. I'm one of the facilitators for the Alliance's Wednesday evening LGBTQ plus pro-recovery eating disorder support group. If you are new to this space, the National Alliance for Eating Disorders is a nonprofit organization that offers outreach, education, early intervention, support, and advocacy services for eating disorders. So if you or somebody that you know is struggling with an eating disorder, help is available. So please reach out to the Alliance. They have extensive referral services. They have several free weekly clinician-led pro-recovery support groups, groups for loved ones, which again includes our LGBTQ plus pro-recovery group. So Maddie, again, really glad that you're here. We are going to be discussing health equity and eating disorders in the trans community today, which we're discussing as part of Trans Awareness Week. Although, Maddie, I think you and I can probably agree that health equity is something that should really be on the table all the time, especially in eating disorder spaces. But before we dive into all of that, can you please introduce yourself and tell us a little bit about the Eating Disorders Coalition?
Sure, of course. So hello, everyone. My name is Maddie Schumacher. I use they, them pronouns, and I am the Director of Policy at the Eating Disorders Coalition. So the Eating Disorders Coalition kind of looks at the same issues and looking at the same communities of those who have experienced an eating disorder and their family members, and really looks at research, policy, and action. So we're the Eating Disorders Coalition for Research, Policy, and Action. And what that means, and a big core part of my job, is advancing federal legislation. So we are really invested in a couple different pieces of legislation that we're currently pushing in Congress right now. And that's a big part of my job, is meeting with congressional offices and pitching our bills and explaining why eating disorders should matter to the Congress member, and why they should be invested in these policy changes. And so that's a really gratifying part of my job, and a big part of what the Eating Disorders Coalition does. Personally, I live right outside DC, so right here in the capital. I'm originally from the Midwest, so my family is in Wisconsin, and I also spent some time in Minnesota too. So my heart's in the Midwest, and yeah, that's me.
I'm in Chicago, so I'm definitely connected with the Midwest vibes. It's nice and dark at 4:03 p.m. currently, so we're just doing our best to make it through that. But yeah, and I'll say for anybody that's listening, if you're interested in advocacy, I've done some myself with the Eating Disorders Coalition, and I really can't speak enough to how gratifying it is, just like you said, and how empowering it is to be involved in something like that. So I'm hoping we'll get a chance to talk some more about how anybody who's might be listening could get involved with some advocacy efforts later on, and some of the different bills that you're working on.
Totally.
But I did want to ask you too, personally, what drew you to the area of health equity and particularly eating disorders among queer and trans folks?
Yeah. A long story for sure. I think that health equity is fundamental to any conversation about our bodies and our lives. As a mixed person of color, as a queer and trans person, as a person who has struggled with an eating disorder in the past, I think that you can't separate any of those identities and any of those experiences, right? We have to bring them all to the table. And that's something that can be hard about doing policy work, is that sometimes policy work and advocacy work and even just professional jobs expect you to leave your identities and your experiences at the door. And that's not the way I approach it, right? For me, I became passionate about health equity because my parents own a small pharmacy in Wisconsin. And I worked there as a teenager, and it was very clear to me the barriers that people face just in terms of accessing healthcare, even on that very local micro level. And, then I moved to working in the Minnesota State Legislature, working on, getting funding and getting supports for children who are dealing with trauma, who are experiencing adverse childhood experiences, and what health looks like in that context, what health looks like in the context of the criminal justice system, is a lot of what I focused on. And I think that when it comes to what I'm doing now in regards to eating disorders, health equity has to remain a key part of the conversation. It's a key part of, when we think of eating disorders and the steps of recovery, right? We're thinking about screening, identification, we're thinking about intervention, referral, treatment. Each of those steps in the line has to have a health equity frame. It has to have a cultural competency frame. And so for me, it's just a really important part of the conversation.
Yeah, I couldn't agree with you more. And I really appreciate you bringing that in, because eating disorders in particular, although of course this is a problem that plagues many different areas of health, but eating disorders, a lot of the research, the treatments that we have, the theories that we have, the information we have is based around a very particular group of people, which is heterosexual, cisgender, white women. And so, trying to take that and apply it unilaterally to everybody else, it just doesn't work in the way that we think it is, or the way that we might want it to. And a lot of the reason for that comes back to these identity pieces that I agree with you, I don't think can be pulled apart, which in the short time that we have today, we'll hopefully talk about a little bit. As you were talking to, I think something I was thinking about, just sort of in context of the time that we're doing this in, when I think about awareness weeks, of course, a big piece of those is visibility, right? For people to see themselves represented and know that they're not alone in their experiences. But for me, I also think that these are really good opportunities for people not in the community to practice some self-reflection and some accountability, particularly for healthcare providers, mental health care providers, eating disorder providers. So anybody that might be listening, I kind of take this as an opportunity to look inward and, critically reflect on the position that each of us plays in either perpetuating health inequities or working to dismantle some of them. So I'm hoping that our discussion can be a frame for that today.
Yeah, completely agree. And even going all the way up to policymakers, how I think that sometimes our political system, the fact that our political system depends so much on compromise, it's a good thing because it's what democracy is. But it also can really easily leave people out. When we think of compromise, it's often easiest to compromise on people who we all value, right? And when we don't value low-income people, when we don't value queer and trans people, it's fine that they can just be left out of the conversation. And so, yeah, I think that, the same call that you're putting out to providers, I think I'm putting out to policymakers as well.
Yeah, absolutely. It's something that's at every sphere of influence when we think about, especially health equity and access to care and all of those important pieces. So with that said, actually, can you talk through some of the barriers to accessing care for queer and trans folks?
Totally. Just, a few simple ones. There's obviously the fear of being misgendered. Nobody wants to go see a provider who is going to misgender them, or who is going to disrespect them, or who is not going to see them the way that they want to be seen. And certainly if you go to a provider who does that, you're probably not going to go back. So I think that that's a simple one. And regardless of people using the right or the wrong words, or people knowing exactly what to say, I just think that there can be a lot of stigma around going to the doctor or seeing healthcare providers. There's definitely a fear of being stigmatized by healthcare staff. So even if your doctor is on the same page with you about what your needs are, what you're looking for from a healthcare provider, there's a lot of other people in a clinic, for example, right? Who you may have to interact with in order to get to the doctor. And then certainly, I think there's a lot of fear of healthcare staff not knowing how to interact with us. not knowing how to interact with queer and trans people. And it's awkward. It's awkward to try and be receiving care and trying to access care when you're hurt or you're sick. And everyone is just awkward and off-putting around you, or don't know how to speak to you. You know, I think in an ideal world, we'd all be able to access healthcare that made us feel comfortable, made us feel affirmed, and made us want to be healthy. And I think that there are a lot of barriers to achieving that for queer and trans people. We know that queer and trans people have lower rates of health insurance. We typically experience higher rates of poverty and discrimination from loved ones and others. And that also keeps us from accessing healthcare privately without people finding out. I certainly, and others who I know, have feared accessing healthcare because of the tie between accessing trans affirming healthcare and coming out, right? So if you're not out, it can be hard to access healthcare, affirming healthcare, or any healthcare at all. The list really goes on and on. But yeah.
Yeah, certainly. Yeah. And I think to expand on a couple of those things as you were talking, some things that I was thinking about. One is, you know, if you're in a space that's not necessarily affirming, or they don't necessarily know how to work with queer and trans people, then it's a burden, right? It's
and it's on you.
Right. How much do I want to take on in order to try and educate these people, in order to help me, which is why I'm here in the first place. And with that too, I was thinking just about, you know, providers and level of affirming care. And I think a lot of times there's this sort of belief of, well, you know, I'm cool with queer and trans people, so that's enough, right? Which is kind of comes back to the awareness piece of awareness doesn't cut it. You know, there's so much more that goes into providing actually affirming care. And I think a really big piece of that sometimes doesn't get talked about enough is that a lot of queer and trans people have negative prior treatment experiences. And all of that gets brought to the next therapeutic relationship. And a lot of times in eating disorder treatment, I think there's this tendency to characterize any kind of resistance as non-compliance without necessarily considering that, you know, some of that might come back to a really hard time building trust if there's a history of negative treatment, you know?
For sure. I remember what you were saying about, you know, the burden that's on patients to educate their providers or to intervene during treatment. I remember seeing this joke on the internet, this meme that was like, someone was getting like a pelvic exam, and their doctor had like a speculum inside them, but was misgendering them. And they were like, how do I correct you while you're doing this? You know what I mean? Like,
pretty
this
much.
is not the appropriate time for me to be like, actually my pronouns are,
Right.
and just, yeah, that it can be really complicated.
Yeah, definitely. Thinking about some more sort of specific things that we run into in eating disorders, one that I think comes up a lot, which kind of comes back to the reality that, you know, the treatments that we have were designed for a very particular group of people and have just been carried forward. A big focus in eating disorder treatment, and also in the recovery community, a lot of times is trying to shift the focus away from the body, or accepting the body completely as it is. And, you know, we know that the role of the body is more complicated for queer and trans folks, for non-binary folks, than it is for cisgender folks. And so that doesn't always fit. You know, that approach to the body doesn't always fit, and can be really harmful for people whose expression through their body is necessary to their health and their well-being. So I'm hoping you can speak a little bit to the role of the body and its importance, and how it might be different for queer and trans people with eating disorders.
Yeah, this is such a complex question.
For sure.
I think that queer and trans people are often really unique in their perceptions of their body. Their body can be a conduit for dysphoria. It can be a conduit for euphoria. And it can be really intimately tied with gender, with health, mental health, and physical health. And this really complicates the relationship between certain treatments for eating disorders and trans-specific issues like dysphoria. However, I do think that it is possible to combat dysphoria and an eating disorder simultaneously. And this is going to be different for every single person, and something that really has to be uniquely tackled between a healthcare professional and a patient. But what needs to occur is treatments where trans people are able to work through highly complex emotions about their body in a healthy way that validates feelings and validates gender, while also allowing a more positive body image to be constructed. And what does it look like to be recovering from an eating disorder and transitioning at the same time? I think that it can be so complicated because I will say from personal experience, sometimes part of the motivation for an eating disorder is transition, right? For example, someone might be trying to lose weight so that they can look more androgynous, or they can look more feminine, for example, or have a more slender figure for gender presentation reasons. Or other people might be trying to bulk up to the point that they're obsessively exercising in order to attain a more masculine presentation, right? And how do you, and then in trans communities, oftentimes these kinds of changing your body in order to fit your gender presentation is really welcomed and it's celebrated, right? You know, you should be proud of the way in which you are able to make your body look this way. But what happens when you're not doing it in the most healthy way? What happens when you're actually getting into some mental health implications of that? And I think eating disorders are so complex because they really exist at the intersection of physical and mental health, I think. And I think that no more is that true than with trans and queer patients. But I really think that there does not need to be a binary choice between current treatment methods for eating disorders and trans-specific bodily perceptions, right? Like, we can think about these in the same frame, and the two can definitely work together, but it's just unique for every person and their specific perceptions of their body and feelings about their body.
Yeah, thank you so much. That was really, really helpful to hear, and I think makes a lot of sense. Well, it is. You're right. It's a really complicated question, and probably one that we could talk about for the next 3 hours instead of the 30 minutes that we have. But I thought you did a really nice job sort of encapsulating the reality of the situation, and I agree with you. I think it's very reasonable to expect that and to ask for that in therapeutic relationships. I think we so often talk about how there's a total lack of evidence for treatment efficacy, especially in queer populations. And that's true. We don't have an evidence base, and that is a major problem. However, we have research, we have qualitative information, and we have a whole world of queer and trans people telling us their experiences. And in some ways it sounds really simple, but we just have to listen to them. We just have to listen. Yeah, right. Take their concerns seriously, believe them, listen to what they're saying, and find ways to incorporate that in therapeutic relationships, which, like you said, I think is totally doable.
Yeah.
So in thinking about that, do you have thoughts about how providers, treatment settings, other sort of eating disorder support services can ensure that their spaces are safe, affirming for people who are struggling? Which is another, I know, big question. But...
Another big question. I think that just as we can't assume that all individuals who are struggling with an eating disorder look the same, we also can't assume that all trans women look the same, or all trans people look the same, or all people of one identity look the same. We can't assume gender, sexuality. I think that a simple logistical accommodation that providers and treatment settings can have to make their spaces safe and equitable is asking for demographic information in an affirming way, and not allowing for things like misgendering, dead naming, other harmful practices. I can't tell you the number of times I've been to the doctor's office and the boxes that you're given to fill out on the forms aren't affirming and aren't accurate.
Which is
And
such an easy thing to change.
True. It's such an easy thing to change, right? And if you hand someone a form that they have to awkwardly fill out incorrectly, then you're already starting off on the wrong foot.
Yeah.
And, you know, my thought personally is that why do you want incorrect information about me? Do you know what I mean? Like,
Yeah.
either you want the information or you don't. But like at least allow me to tell you the correct information. I think that there could be a lot of updating language around gender neutrality. If someone is referencing people with uteruses to talk about menstruation, then just say that. And this is going to take a lot of education on healthcare providers, a lot of system changes. But I think that this would create really meaningful change that allows for trans affirming care to be much more possible. And I also want to expand what we think of as necessary for trans affirming care. So, sorry, this is hard to put into words, but I think when we think of accommodations that providers can make to make their care trans affirming, we're mostly thinking of primary care providers, right?
Mm-hmm.
We're mostly thinking of mental health providers, the kinds of quote unquote frontline providers that we expect trans people to be in contact with. But what I want to reframe is that we need to include specialty providers, for example. One time I was having gastroenterological problems and I went to see a gastroenterologist and I had a really terrible experience there. And I didn't go back. And I dealt with my problems, you know, in my own way. But that's not actually healthy. That's not good. But nobody's talking about trans affirming gastroenterology. It's just not part of the conversation. And
Yeah.
so I really think that we should broaden what we require in terms of safe, equitable, trans affirming health spaces to include all health spaces. Like, we deserve gastroenterology. We deserve that kind of care.
Yeah.
And we deserve dental care. We deserve all these other types of care. And so, yeah, I think it's the real question is, how do we get through the barriers that already exist, because so many organizations, so many institutions, so many clinics are already overworked, understaffed, lacking the funding, especially ones that are explicitly trans affirming, are, you know, overworked, underpaid, etc. And so how do we bridge that? I personally, as a policy person, think that there could be funding from the federal government for that. But yeah, does that kind of answer your question?
Yeah, totally. And I'm totally on board with you. And, you know, I think everything that you're saying gets back to the point that really this is a systems level issue. You know, it's not an individual level issue, although that's really important too, right? On an individual basis, providers need to be doing everything that they can to provide affirming care because that's your job. However, on a broader scheme, it's a system level change, which I think is where the, you know, the spheres of influence come in. And I think, you know, trying to put those puzzle pieces together, where everybody's sort of individual responsibility is to examine, you know, what spheres of influence they have, what privileges they have, what power they have in the systems that they operate in, and how can they contribute to the dismantling of some of these problems across those spheres of influence. And at the same time, you know, that it requires work from the top down, and that's where policy and funding and all those really important pieces come in too. Speaking of that, before we run out of time, I do really want to take a few minutes at least for you to talk briefly about some of the policy that you're working on, and maybe tell us a little bit about, for anybody that's interested in getting involved in advocacy or getting more involved with health equity, what are some ways they can do that?
Yeah, great question. This is what I'm actually good about talking about. This is my actual job. I could talk about our policies in my sleep. So one bill that we recently introduced is called the Improving Mental Health and Wellness in Schools Act. And what we know is that the pandemic has been has had really alarming impacts on adolescent mental health and youth mental health. I think anyone who has eyes can see that this is the case, that, you know, quarantine and isolation has bred mental health struggles for a lot of people, but especially youth. Simultaneously, schools used to be the place where 50% of students received mental health care. And so the fact that schools were closed and that
Maddie, I don't know if you can still hear me, but the audio just cut out for some reason. Oh, there you
oh,
are. Okay.
I'm back. Hello,
Okay.
sorry. I'll skip to the point since I know we have, not that much time, but there's just a lot. But basically the bill, we're trying to modify existing policies that schools have to put into place when they receive free and reduced price lunch programs that currently encourage schools to implement nutrition education, obesity prevention, and physical activity. And in practice, what this has looked like for a lot of schools is that it's basically just become an obesity prevention program
Right.
without consideration of mental health, without a conversation about, the possibly detrimental impacts that could have. And so we're trying to integrate mental health promotion into these existing policies and offer technical assistance to schools and states to make sure that they have the resources necessary to care for their students and support their students coming out of this pandemic. That's one piece of legislation. The second piece that I'll talk about really briefly is called the Nutrition Care Act. It really, what we're seeing is that Medicare, which covers seniors and disabled individuals, has a gap for coverage of medical nutrition therapy, which is nutritionist or dietitian services. If you're on Medicare, you can't get access to outpatient nutritionist services, not paid for by Medicare, even though that same service is provided for folks with other diagnoses, like diabetes, for example. So really cut and dry, the bill just fills in that coverage gap, makes it so that we have parity for eating disorders, and that Medicare beneficiaries can receive that coverage. So that's really briefly two of the bills.
Yeah, I know. I wish we had an hour to talk about these. They're really exciting, and I think both really great examples of what systems level change can look like and how it might actually benefit people in terms of improving their access to certain things. We could spend probably an entire other conversation talking about obesity prevention programming in schools and all the whole can of worms that is that. But for anybody who might be interested, what are some ways that they might get involved with the EDC, with advocacy efforts?
Totally. So you can go to our website. You can, I am on the EDC Instagram right now, so you can just click the Instagram, and we have an action alert system where you can sign up with your email and get action alerts from us. I promise we only send them out when it's really important. But, what that really means is that sometimes we, part of my job is to pitch, let's say, a congressman. And then after that, we might send out an action alert to his constituents so they can chime in and say, we really want you to co-sponsor this. We really need you to get on this. And so constituent outreach is super, super helpful. It's more impactful than anything I do, is getting constituents to talk to their members. And so that's number one way that you can get involved. Sign up through the email address, and then just follow our social media. We have Twitter, Instagram, and Facebook, and we'll send out updates through that too.
Awesome. And yeah, I'll just reiterate again for anybody who might be remotely interested, doing this kind of advocacy work and participating on any level, it just feels really good. It's really exciting to be able to participate in something like that, especially when it's successful. It's really, really exciting. So thank you so much for sharing all of that. The last thing I'll ask you, and I ask you this because we've talked through a lot of the difficulty with eating disorder treatment and health equity, right? And in an effort to not paint too bleak a picture of the state of things, I kind of want to reiterate that there are people out there who get it, who understand, and who are doing this work, like yourself. So before we wrap up, what would you say to any queer or trans folks or anybody in the queer community who's struggling with an eating disorder and kind of unsure what to do with that right now?
Yeah, I think that the first thing I would say is that there are a lot of people who are struggling with the same thing as you, and you're really not alone. This is something that so many trans people struggle with, And the medical system can be so brutally demoralizing when you're struggling with this as a trans or as a queer person. But it's really, really important that you know that you don't have to give up, and you can take a moment to look into the resources that are provided by National Alliance, other resources that are available. There is help available, and there are people who understand, and they're sometimes hard to get to, but it's worth it. And I think that that's just really important to remember for anybody.
100%. Couldn't have said it better myself. With that said, that is just about all the time that we have. We covered a lot of ground today, asked you a lot of really big questions that I wish we had more time for, but again, really grateful that you were here, for everything that you shared. I feel like this was a really great opportunity to talk about this topic, and I appreciate everything that you shared with us. So thank you to Maddie, thank you to the Eating Disorders Coalition, everybody that was here to participate. If you are a provider, if you're an advocate, there is work to be done, as we've talked through. And like Maddie said, if you're somebody experiencing an eating disorder, you're not alone. So check out the Eating Disorders Coalition, check out the Alliance. In particular, if you're a queer person who's struggling with an eating disorder, you absolutely deserve support. You can join us for our LGBTQ plus pro-recovery eating disorder support group. That is free and meets every Wednesday at 7 p.m. Eastern Time. You can find information about that group as well as other Alliance support groups and their referral services either here on the Alliance's Instagram or on their website, which is allianceforeatingdisorders.com. You do need to register ahead for the support groups, and this conversation is also going to be saved to their page if you want to check it out later, share it with anybody, send it along to anybody who might benefit from some of the information that we talked about. But all of that said, again, thank you, Maddie. Super exciting to talk to you, and thank you to everybody that was here, and I hope everybody has a good evening.
Thank you so much. Thank you so much.
Yeah, nice meeting you.
Nice meeting you too. Bye-bye.